So we're just going to start with having a little look at the value of breast milk for health. So you're here to find out more about breastfeeding, and one of the things that's really important for you to know really is what are the benefits of breastfeeding. I'm sure you've heard that it is good for your baby's health, but it's also good for your health as well. There's lots and lots of properties in breast milk, and it's all very well researched, very well evidenced now. So we have a wide range of strong evidence that tells us that breastfeeding can help improve many health outcomes and reduce the risk of many health problems as well. So let's have a little look here first at human milk versus bacteria. So this image is really good. It's an image that was posted on Facebook by a biology student. So she had colonised some petri dishes here with bacteria M. luteus, except for the centre where she's dropped in a little bit of breast milk, as you can see on the image. So what breast milk is doing here is you can see that it has provided protection against that bacteria. And this is one of the overarching properties in breast milk. It is so fantastic for fighting infection. Breast milk contains things like immunoglobulins, enzymes, certain proteins, healthy bacteria, and white blood cells. All of these things really contribute to its ability to fight infection. It has the ability to target, capture, destroy and engulf bacteria and viruses before they even get into your baby's system and become an infection. So really amazing quality, and it's definitely something that you should take on board, to think about protecting your baby against infections, especially when they're first born and they have quite an immature immune system. It also protects their gut, it coats their gut, it protects the gut lining, and it prevents bacteria from entering the body via the gut. And this also protects against allergies, common allergies like eczema and asthma as well. So as we've just learnt there, did you know that there's actually more white blood cells in 1 teaspoon of milk than there is in 1 teaspoon of blood? It's quite amazing really when you think about it, that the fighting properties of breast milk is that significant. We think about white blood cells in our blood as the immune fighting, the antibodies protection against infection. And one of the useful things that you can remember about this fact here really is that when your baby's born, if they get a kind of eye infection, it's quite common for newborn babies to get sticky eyes. A lot of mums have found great success by just dropping a few drops of breast milk into the eye, like eye drops, because the breast milk itself will clear any bacteria out of the eye, and it can clear away sticky eyes really quickly. The same if you get a sore nipple that potentially could become infected, then you can use breast milk just to settle and soothe that wound really, and it really helps with healing. Babies are breastfed are 15% less likely to develop juvenile onset diabetes. So this is type 1 diabetes that comes on in childhood. Diabetes and the prevalence of type 1 diabetes is on the increase in this country. It is a problem, it is getting more prevalent, and we know that breastfeeding is one of the things that you can do to try and bring down the risk of your baby developing diabetes. It's especially important if you have a family history of diabetes, if you yourself are a diabetic, and particularly if you are a type 1 diabetic, then this really should jump off the page to you. This should be something that is glowing with appeal, so something to definitely consider. We also know that babies who breastfeed are much less likely to develop very common respiratory infections. So things like chest infections and bronchiolitis often cause babies to be very poorly, and into toddlerhood really can result in admissions because of how seriously that's affecting them. So when you breastfeed, you do reduce the incidence of your baby having these sorts of problems. And there's a benefit for you as well, because breastfeeding greatly reduces your risk of developing breast cancer and ovarian cancer later on in your life. And it is quite a significant reduction. It can range anything between 20 to 30% reduced risk of developing these cancers later on in life. And again, if you've got a family history of breast cancer, it is something that will be of interest to you. And it definitely does reduce the risk of those hereditary type, gene mutation type breast cancers. There's also the benefit that breastfeeding is completely free. It doesn't cost you anything to breastfeed your baby. Whereas obviously if you decide to formula feed, you will have to lay out some costs to purchase your formula. There's no getting around that, where you have to buy formula milk. So on average, and this is a very average estimate really, annually it would cost you around £800 to buy your powdered formula for your baby's supply for that year. If we break that down to a monthly cost, then that's about £65 a month. And that's not taking into account the cost of bottles and teats and sterilising equipment. So, you know, it's potentially financially might be something that you really have to consider. It depends. We all have very different circumstances, but it might be something that appeals to you. Breast milk is also, and this is a really, really wonderful thing to bear in mind, breast milk is also known to be lethal to over 40 types of cancerous tumours. So the variety of tumours out there, 40 of them, breast milk is lethal to them, basically. So with this, we know that it reduces the risk of your child developing cancer. And it's a worrying thing, isn't it? You know, we know the risk of cancer is high, you know, tell you 1 in 3 of you will get cancer in your lifetime, and it's scary. We all think about that, but you know, we know breast milk now is has a protein within it that is lethal to tumours. So a really interesting one there, and definitely one that's worth bearing in mind. So we'll have a little look at colostrum now. So colostrum is the first milk that your baby will feed from you. So this milk, we call it, you know, the superfood of milk. Really, it has so many benefits for your baby. Another name for it is liquid gold, and this comes from the fact that it has a kind of golden appearance to it. It is nature's first milk and produced. It's actually produced pre-birth in your 3rd trimester of pregnancy, while your breasts are maturing and the tissue inside your breast is changing and getting ready for the arrival of your baby. It will start to practice making milk. And so some of you may be leaking colostrum and some of you don't. In either way is perfectly normal. But if you do leak colostrum, do not worry about that. That is absolutely fine. But it does have this golden appearance to it. If you look at the syringes down the left-hand side of the screen here, it doesn't look typically like milk. It doesn't have that white creamy appearance that milk has. It's a little bit more see-through. It has this sort of yellowish appearance. It's quite thick. It has the texture of syrup, actually. It's kind of thick and gloopy, and so it you know, we call it liquid gold, but it's also liquid gold because, you know, money couldn't buy colostrum. It is absolutely fantastic for your baby, and so it's definitely a value to them, no matter how much they get. So colostrum comes in very small volumes. It's not provided in great big voluminous feeds at all. It comes in really just a few mil per feed. We'll talk about tummy sizes and feeds later on, but if you were to express colostrum, you'd probably express in the volumes you're seeing on these syringes. So they're all 1 mil syringes. So the top one is like 0.2 of a mil, and then we have 0.1 of a mil, and then the bottom one, it's full, is just over 1 mil. So you can see it's very tiny amounts. But what you have to know about colostrum is that it has all of the same properties of full milk. It has the same calories, the same nutritional content, and it's loaded with antibodies, but it is very low water volume. What that is like nature's protection for your baby's immature kidneys, really. When they're first born, they're born with extra fluid on board. They're quite puffy, a little bit swollen. And in those first for 24, 48 hours, your baby's kidneys are working extra hard to process all that extra fluid. So we know they'll produce plenty of wet nappies, even though they're only having small volumes of colostrum. And that's the way that nature intended it. Like I mentioned, it has lots and lots of antibodies in it. These are tailor-made antibodies from your immune system. So any pathogens that you've come into contact with throughout, you know, your life, your historical pathogens, where your antibodies you carry around with you, but also the environment that you're living in, those antibodies are produced, passed straight into your breast milk. So your baby gets designer antibodies from you, made specifically for them and their family and their environment. So, you know, we encourage you to stay with your baby as much as possible and spend lots of time being close in those first few days so that you can protect them. It is also a laxative. So colostrum is kind of, again, nature's way of kind of purging your baby's system, and it helps pass that meconium, which is the name given to the first poo. Meconium is basically a build-up of residue in the baby's bowel that needs to be eliminated, and it often contains quite high levels of bilirubin in meconium. So if your baby excretes that meconium really quickly, there's no time to reabsorb some of that bilirubin. So it can help in reducing your baby's risk of developing jaundice, which is normal, but some babies do get more jaundice than others.